While GLP-1s are great at kind of jump starting this process, you must utilize that window to change your lifestyle.
Sometimes I'll go on Instagram or social media, what appears to be two experts, they tell me diametrically opposite things, right?
So at the end of the day, I want people to have a strong core, way more important than having a six-pack. Because having a six-pack isn't about strength. Having a six-pack is you have to get your body fat down to a certain percentage to expose it.
But what's the non-obvious answer? Is there a position that we can, avoid, or a position we should aim for when we're looking at our computers or looking at our phones?
I'm not saying don't doom scroll on Instagram. Go ahead and do it, but just do it with proper technique.
So Dinesh, as you know, my family and we were just in India visiting my grandmother who turned 100.
Congratulations.
And yeah, thank you. She's got some wild stories that she just treats as if they were like everyday things. Like, oh yeah, I just popped into the grocery store to buy some orange juice. Oh yeah, I watched somebody get sliced open during the partition. No big deal. Totally normal. But it was great to see her, and I've always been very close with her, but it was great to see my kids connect with her.
Yeah.
But I think as many of our listeners might relate to, it's like when you see someone in your mind, you have a specific image. But then if it's been a while since you've seen them, the toll that time takes on their physical body can be really jarring. Yeah.
Mm-hmm. Yeah, absolutely. Absolutely.
Yeah. And so what got me this time was how hunched over she was.
Mm.
She can, when she's sitting, she looks, slouched over, but okay. But it's not till she gets up and then she gets her walker. She can still take herself around the apartment minimally. But she's really hunched over.
Mm.
And I found myself going, oh my God, I know that this can be a function of age, but I found myself really thinking about my own spine and what I can do to make sure that I'm keeping it flexible. I'm encouraging, more flexibility, more strength, because I've heard that the more flexible your spine, the younger you are. And that's why I'm really excited about today's show.
Yeah, I'm excited too. We have Dr. Ricky Singh, who is, coming to us out of Cornell Medicine in New York. He's sort of someone I've known for 6 years. I've consulted with him about my parents and their spine issues. Shout out to Chris Agarwal for connecting us, as well as Vinay Chadha, who I believe is running the Chicago Marathon with you, right?
That's right. Hey, thanks for having me, Seema, Dinesh. It's really a pleasure to be here and be part of this show. Vinay and I have run 3 marathons together.
Wow.
We did Berlin and New York last year, and this year we're doing Chicago and New York. And next year, probably London and New York. So we are going through our own midlife crisis, which includes marathon running.
I love
But
it.
yeah, we've known each other a long time.
That's cool. Well, welcome to the show. We're really excited to have you. And I think that this episode, listeners, you're going to get something not only by the way of inspiration, but also how to keep yourself healthy, active, and upright for longer than you would without the show.
Absolutely. And Seema, your story kind of resonates with me. I mean, these are the people that I see on a daily basis. And I think, one thing that's fundamentally changed a lot in the way we talk about spine health, historically it was always you don't see a doctor for your spine until something hurts, right? Pain is your first indicator that I need to see someone about it. But what's happening is that, 40, 50 years ago, doctors and physical therapists and other spine professionals really wouldn't intervene unless they were going to do something about it. So the concept of preventative health and spine, not only flexibility, but also stability, weren't really stressed. And that's why you see people kind of hunching over because, what's working against us? Gravity. Gravity is working 24/7. And if you're not opposing the forces of gravity with your own muscular strength, yeah, you're going to start looking at your shoes instead of the people around you. And that's where we in our generation and our age can really make a difference to prevent that for the future, us.
Yeah. Yeah. I mean, that hits home for me right back at you. I mean, I don't practice anymore, but as a dentist, like nobody comes to see me until they're hurting. And then, oftentimes it's like, well, we could have prevented this. Right. And, but to build on that too, it's us, but then I see it even for my kids, right? The technology is just in their faces and we can try to protect them or mitigate that as much as possible, but that is just their world. And so, and when you're, I have a 10-year-old, a 13-year-old, they don't get it. They think that they're, you feel immortal when you're that age. And so this idea of hunching down, the idea of like doing spinal bends, moving, all that stuff, they're active kids. But to your point, every time we look at our phones, every time we're on this planet facing gravity, that it's something that we need to think about. So I'm really, really excited to hear what you have to say.
Yeah, absolutely. There's data on, what you're calling tech neck, right? Tech neck
Yeah.
is the whole concept of leaning forward. And the way I conceptualize that to patients is I talk about numbers. I mean, they really can understand numbers. So your head and your brain weigh about 8 to 10 pounds. And that's
Mhm.
if your head is neutral, where your ears are sitting over your shoulders, your neck and your upper back are taking about 8 to 10 pounds of weight. If you lean forward 5 degrees, that number doubles, now 16 pounds. If you lean on 10 degrees, it triples. Now we're at 30 pounds. And when you're texting someone, you're actually at almost 45 degrees bend. Now we're talking about 6x the weight, 6x the weight of your brain and your skull on your neck and upper back. And that's not just once. Studies have shown that you pick up the phone 180 times a day. 180 times a day. I mean, that's a ridiculous number. But think about that repetitive stress on your upper back and neck. So yes, as kids, you're immortal, even up to your 30. We know there's kind of three sentinel age changes: 30,
Mhm.
65, and 75. Those are like the three big numbers of when your body says, hey, you're not as young as when you're supposed to be. So, but you're right, intervening, limiting screen time, all these kind of modifiable activities can really make a difference in the long run.
We'll get into all of that, and just to give a sense to the listeners about your professional experience, like let's make sure that no one questions what advice or what we get into by way of credibility, but also share a little bit so they get to know you. We talked about the marathons, but who is Ricky Singh? What does he care about? Why did he become a doctor? And what is the non-Googleable side, so that we recognize that this advice isn't coming out of a textbook or what we're talking about. It's coming from a real person that we can relate to, that we can see ourselves in.
Yeah, all fair questions. So yeah, so just going back a little bit. So I'm here in New York City. I work at Weill Cornell Medicine and part of the New York Presbyterian hospital system. Originally from St. Louis, born and raised from St. Louis. I'm a Midwest boy, despite how long I've been on the East Coast for all of my training and education. In my heart, I'm still from St. Louis. My parents still live there. I kind of went into medicine thinking I was going to do orthopedics. Like that was my passion, was ortho. I rotated with an orthopedic surgeon in high school. And I was like, this is so cool, the body and bones and joints. So I really thought I wanted to do that. And then after medical school, I spent a year doing orthopedic research. And then I went to surgical residency in Boston. And I found myself really drawn to clinic. I loved seeing patients after surgery, how they were functioning, were they still in pain? What do we do as orthopedists to really accommodate that? And I wasn't in love with the operating room. The operating room was kind of a quick fix type of scenario. And I found that in my residency anyway, the surgeons didn't have much long-term follow-up. They'd fix a bone, make the x-rays look pretty, and then send them to rehab. And I was like, what is rehab? Like, what is that really about? So that really piqued my interest in my specialty, which is physiatry, physical medicine and rehabilitation, because I really liked seeing the long-term follow-up of functional medicine. Like, what happens to these people? So I pursued my residency. I went to Penn for residency, and then I did a fellowship in sports and pain. And then I came back to New York. But, you know, I think part of why I'm so drawn to this field is culturally. You know, I'm Indian by ethnicity. My parents were born in India. They came here. We believe in mental health. We believe in physical health. We believe in spiritual health. And, I don't think one is separated from the other. You can't really practice good mindfulness unless your body is in shape, and vice versa. If your mind is all over the place, how's your physical health going to be impacted? So I really try to frame that every time I see a patient, not just talk about their spine or their one disc, but also take a step back and let me talk about your lifestyle. Like, are you
Mhm.
exercising? Are you sleeping right? How's your nutrition and diet and supplements? How's your mindfulness? And that's the focus I really take with every patient. And that what I bring value to our multidisciplinary spine center is just this comprehensive functional approach on spine health. And that's what I like to talk about because I can only see so many patients in a day. But having outreach through, your podcast and my newsletter could really reach a larger audience.
Yeah. And I love what you said. Surgeons notoriously have this rep, right? Of like, get in there, cut it open, fix it, and then you're done. And I know there's a growing movement of surgeons who are less trigger happy, if you will, and they are leaning towards a more comprehensive approach. But I think, especially in the system that we're in, not to point fingers or blame or anything, but just kind of recognizing what is and how healthcare is in this country. I think having providers like you who are willing to take a step back and say, how is this all integrated? I don't know if it's changed now, like how kids are being trained now. It wasn't like that when I was going through training, and it wasn't like that when, many of my peers were going through. And so it's great that we've got more and more of that going on.
I still think there's a gap though. We call it in the United States, we call it healthcare. And I don't think it's healthcare. I think it's sick care. We wait for
Yeah.
something bad to happen to someone, then they come see us, and it's great. We're good at intervening. But even
Yeah.
at Cornell Medical School, there's very little education on nutrition. There's very little
Mm-hmm.
education on supplements and stretching and flexibility and exercise. It's all on Western medicine, which is we're the best. Western medicine is the best at intervening, no doubt about it. We have the best technology, we have the greatest tools, but we're kind of trash at prevention.
Yeah.
And that's probably because the way the payer system works is that we don't get paid to prevent injury, we get paid to do things. And I think for me, it was just not satisfying. I was just so tired of saying the same thing over and over and over to patients when I could just say, don't see me. Here's some tools, here's some exercises, here's some tips to not have to need me. Maybe it was a terrible business model, but what I found was it was an incredible business model, because then these patients were like, let me tell all my friends and family about you, because you're not
Yeah.
just doing, you're educating. So I think there's some satisfaction that way. But I think healthcare's
Yeah.
got to change. I mean, it's not sustainable how much we spend on spine health and back pain. We got to do
I
something
agree.
different.
Yeah.
Yeah. Yeah.
So I'm curious, and I know we'll get into this, but I think at this point, the question that's coming to me is, walk us through your day. What are some of the things you do when you wake up, and that you do for yourself to help with prevention, help with mindfulness, help with flexibility, things like that? Because let's be honest, a lot of our audience are white collar professionals. We sit at a computer. We're either standing, we're physicians or dentists, and we all have a phone, right? And we're all looking at it. I don't know about you guys, but I'm convinced everyone needs to be on social media and should have a personal brand and be an influencer. So that just means we're going to be looking at our phone a little bit more. So walk us through your day and some of the things that you intentionally do so that you could avoid having to see yourself or taking your advice in the future.
Yeah, I think that's a great point. And I want to preface this with consistency. I think you have to have a plan, and that's part of what I conceptualize when I do marathon training. You can't cram for a marathon like we could in medical school and dental school. You could cram for a test, right? Study
Yeah.
all night and you could do fine on the exam. But a marathon you can't cram for. It requires training, 16 weeks, 20 weeks of consistent programming. So I think the same is true for our body. If you go back like 30, 40 years, cardiologists were great at branding cardio, aerobic exercise, right? The American College of Sports Medicine, American College of Cardiology, they said you must do cardio because it's good for your heart. And yes, we've all done that for the last 30, 40 years. And now we're realizing, you know what? That probably wasn't the right move. There's definitely some benefits, cholesterol, triglycerides, and things like that. But in terms of longevity, functional independence, really it's resistance training. You have to do some weight-based activities to build muscle, to prevent bone loss, to keep yourself functional. I preface my whole comment on that because that's how I frame what I'm going to be intentional with. So with me, I wake up in the morning, usually 5:30 to work out. That workout is a combination of cardio, resistance, some yoga. And I don't make it every day. And I don't beat myself up over it. If I have a dinner party one night and I don't want to wake up, cool. It's not a big deal. Because if I'm negative about not working out, I'm just going to be more negative about it. So if I make
Yeah.
it 4 times a week, super. That's a successful week. And I think rest is important too. So just doing something. So I try to get my workout done in the morning because I know myself, after I shower and go to work and come back, hang out with the kids, I'm not going to work out. I just know myself. I just don't have the energy to put my sneakers on and get to the gym in the evening. So I get that part done in the morning. Some of it's some mindfulness. I listen to some of my sick prayers and things like that in the morning. 5 minutes. I mean, that's all you need just to disconnect from your phone and recenter yourself. I think breathing is super undervalued. It's funny. People do intentional breath exercises. You really feel different in your body. You can control your heart rate. I teach my kids box breathing when they're getting stressed or anxious or upset. Adults should do that too. We spend so much time. I don't know if you have kids, but we spend so much
Mhm.
time sleep training our kids. What about humans? We're terrible sleepers. We look at our phone and then we say we're going to go to sleep now, but that light hits the cones in your retina and you're not going to sleep anymore because everything's perked up. So work, come back. I'm very fortunate. My kids' school is across the street from where I live. So I get to take them to school a couple of days a week. I get to pick them up a couple of days a week. My wife does the same, so we go back and forth. And then it's kids' time, family time. I do my best to leave my work at work. My notes, meetings. So when I'm at home, I get to be kind of intentional with the kids. And then kids go to sleep. Wife and I have dinner, watch some murder show on Netflix probably, and then it's bedtime after that, and kind of a rinse and repeat.
Okay, side note, have you watched The Royals?
I have not watched The Royals.
So I binge watched it while we were in Mumbai, and I'm severely regretting / loving that I did. Great show. Just I'm gonna leave it at
Is
that.
there murder involved?
There is no murder, but there's a lot of it even got like my male friends, like they were in it. It
All
was
right.
very engrossing. But yeah, I love, what you said for many of us, and I'll admit to this. I tend to subconsciously beat myself up when you don't wake up exactly when you said you were going to, when you said you were going to work out today, but you didn't. And the reality is, especially with kids, life is shifting. Right now, when we're recording, this is summertime, and it feels to me like any sense of order is gone, despite our best efforts to do it, just because of the nature of how our lives are. But I love that you touched on, there's still, you can do 5 minutes.
Hmm.
You can do a walk around the block. You can do even like on Peloton, there's like, you have 10 minutes, great, do
Hmm.
10 minutes of weights. Like, there's all sorts of things you can do to sort of keep your bigger goal in mind and still find some way to stay consistent.
And that's the
Yeah.
key. You said it. It's consistency is more important than intensity.
Mhm.
Simon Sinek talks about this. He's like, if you go to the
Mhm.
gym and do 1,000 crunches and look in the mirror, I mean, your abs look the same, and you're going to say that doesn't work, and you're going to forget about it. But if you
Yeah.
go every day and do 2 crunches or whatever, yeah, in 3 months, you're going to notice a difference. And that small micro movements, just micro things, micro mindfulness reset, micro
Yeah.
walking, whatever. I think it's swallowable. Patients can digest that and maybe implement it.
Yeah,
Yeah.
absolutely. What struck me as you were describing your day is how relatable your day is. You wake up about 5:36, you work full time, you spend time with your kids, you try to shut it off, you watch TV. And I've in researching you, I found a post from sick writers on Facebook, and they said Dr. Singh's excellence in care has earned him top honors like America's best doctor and New York super doctor's rising star, right? So you're not someone who is sort of middle of the pack. You're probably internationally recognized. You're really nationally recognized for sure. But your day is so simple that it also almost makes the rest of us feel like when we say we can't work out, we don't have time to work out, we don't have time to get to bed at time on time, we're making excuses. And the reason that this is top of mind is I recently found a guy in Tampa, Florida. Get this. He's a practicing plastic surgeon, as well as a partner at a law firm and a practicing attorney. And in his day, he finishes up surgery in the morning, about 12, 1 o'clock, and then goes to his law firm and represents clients. And if you follow him on social media, I'm happy to share later on. He surfs, he spends time with the kids, he has time to make silly TikToks and dances online and all that. So really, the things that we're talking about, they're not monumental asks of
Mhm.
people. I think balance is achievable. And if we have to call a spade at a time. If we're saying that I can't get to bed before 2 a.m. because I'm so important, so busy, or I don't have the time to work out because the kids they have so many activities, at some level, we're making excuses and we got to call it out.
Yeah. And I try not to use the phrase "I don't have time" because that's a lie. I mean, there's this much time in a day. We know that. That's a real number. When we say "I don't have time," what we're basically saying is I'm not giving that priority. I'm going to give something else priority. So I'm not going to take the time to do this thing. And if
Mhm.
you shift the mindset from victim to being responsible for your own plan and your own daily record, then you're going to think about what's the most important things in life to do, and you're going to prioritize that. So I don't like saying I don't have time. You really are saying that's not important to me, so I'm not going to do it. So, but
Mhm.
budgeting a little bit of time for the things that are important to you. And I tell my patients, yes, it's great. You have to do work and it's great. But if you're not taking care of your mind and your body, I mean, what's the point of all this? Don't think about how you're going to feel tomorrow. Think about what does the 10 years from now person look like? And if you don't
Mhm.
start making incremental changes now, then that 10 years from now person is not going to be the person you're happy with when you look in the mirror.
Yeah.
And that's what I tell my patients. I did a talk with my fellows who are graduating about finances and like financial freedom and like how to build wealth and all this stuff, because this stuff is important, obviously. We live in New York City, it's a competitive space. And I said, the goal isn't to make money. There's no number, right? Everyone thinks, what's the retirement number? There's no number. The reason why we make money is to give ourselves time to do the things we want to do. That's how I frame it. Because
Yeah.
you could work forever. I could work 24 hours a day and make all this money. And then what? What am I
Yeah.
doing with it? I'm not spending any time with my family and my friends. So what's the point? So the point of making
Right.
money, in my mind, yes, you got fixed costs, food, rent, mortgage, housing, education, all that stuff. But then it's really to take time for yourself and your family and do things you want to do. And that really
Mhm.
creates mind balance. I have this story. I have to share the story because I share this story with every incoming resident that comes. So I treat a lot of finance bros in New York City. And, I didn't understand what the finance space was when I got to New York. I was like, what is Goldman Sachs? What is Bain Capital? What are you guys? So I really
Yeah.
learned what these people do. I saw a young patient. He was my age when I started working. And we just exchanged information like, how much do you guys make? I was like, this is how much I make. So I saw him kind of climbing up the ladder in his firm. He had one kid, two kids, moved out of the city to Long Island City, then moved into Long Island, had a third kid and moved back into the city. And I'm like, dude, you had three kids and now you're back in the city. He's like, oh, I made partner. And I was like, oh, you're done. Like, what does that mean? Your salary's up? He's like, my salary's about the same, but I got a bonus. And my bonus was like 10x my salary. And I
Wow.
was like, oh, so you're done. You're out of the game. And he's like, Ricky, you would think so. But the 10 years ago of me would have said, yeah, I'm out of this game. I'm retired. I can do whatever I want. But now my circle of friends are all 100 millionaires or whatever.
Yeah.
And the 100 millionaires circle is billionaires. And this hamster wheel never ends. And I remember this was 2016. I went home to my wife and I'm like, I'm changing my attitude about money and goals. And there's no number anymore. There's no destination. Let's
Yeah.
just enjoy the
Yeah.
journey, live and practice what I want to practice, and that's it. I'm tired of tracking data. Everyone wants to track your net worth and
Yeah.
personal health and mint. Unnecessary. Just one day at a
Yeah.
time.
Yeah.
I love it. I love
Yeah.
it. Just hang
Yeah.
out with a bunch of attorneys. You'll feel rich.
Not in New York. I mean, these guys,
Yeah.
mergers, acquisitions. Oh my God.
Yeah.
Yeah. But
I
but
mean,
I
but there's always another level,
yeah.
right? Like they make comedy shows about this. There's episodes of, that old show Frasier, and I can think of a million more that have they poke fun at this. There's always that other level, this coveted level that you tell
Mhm.
yourself like, I need to get to that, and
Mhm.
then but I'm sure people say that too, even about their health, right? Like, so what is it that you feel people are missing? Because I know, like, for people like my grandmother, they look and they're like, if I could just stand a little straighter, right? If I could just have a little less pain. Um, I look at my daughter who can get in Bhujangasana and Cobra pose, but then she can actually take the bottoms of her feet and touch them to the back of her head, right? So her spine goes like all the way. And I'm thinking, yeah, I'm in great shape for in my young 40s, but there's always another like, I wish I could do a little bit more. So what can we do for our spine? Talk to us about, where do we start if we've never considered spine health? Where do
You,
we go?
you nailed it on the head, which is patient specific goals. Like, how often does the doctor ask the patient, like, what are your goals? Like, what do you want to accomplish? Rather than saying, this is my goal for the patient. of
Mm-hmm.
functional health, it's really important to ask the patients, like, what do you want to do? You want to play with your grandkids? You want to pick them up? You want to climb a flight of stairs? Do you want to walk from the couch to the kitchen without your walker? And that's what we're going to work towards. Because when you identify what the patient's goals are and then work towards that, they're much more likely to achieve them. If I say to a patient who's sedentary, who's morbidly obese, who has knee arthritis, and I say, listen, I need you to exercise 150 minutes a week, they're going to do zero. They're literally
Mm-hmm.
not going to get off their couch because I set such a ridiculously lofty goal that they can't
Yeah.
relate to that. If I
Yeah.
say, I want you to stand 5 minutes a day, they're like, okay, I can get there. Start with 30
Mm-hmm.
seconds at a time. Although you like to watch a show, every commercial, stand up, then sit back down. Like these simple things, what I tell patients, the sit to stand from a chair, especially for an elder adult, doing a sit to stand without using your hands is a great way to build functional strength in your glutes, in your lower body, which prevents you from needing an assist device in the future, like a walker or a cane. And that's a simple exercise most of my patients can do. They just never thought about it. So, starting with one step at a time, I tell everybody in my training program, my faculty members, every destination, every journey starts with one step at a time.
Right.
No matter how big that step, just worry about the next step and worry about the next step and then build goals. And just like, again, I go back to my ridiculous marathon training because I'm in the thick of it right now. Start with 1 mile, then 2 miles, then 5 miles, but don't think about 26 miles on day one. Otherwise, you'll get depressed. And
Yeah.
with your grandmother in particular, for her, it'll be just about stand up straight once and sit back
Mm-hmm.
down. Do that once an hour. And before you know it, those muscles are going to start getting rebuilt. And that's why patients come to see me. And I tell patients, listen, I'm not going to make you stronger. I'm not going to make you more flexible, but I am going to help with your pain. And if I help with your pain, you need to promise me that you're going to do your work
Mm-hmm.
and do the exercise and do the home program so that, I don't need to see you again.
Is it all functional? Is it all sort of musculoskeletal, or does your BMR or your activity level and all of that tie in? And you know, talk to us not just about what Seema's grandmother can do or sit to stand with activities assisted device, but what can we do in our 40s and our 30s, and more importantly, we heard about Seema's daughter being able to touch the back of her feet to our heads. As parents, you have kids. I'm not sure how old they are. Mine are 10 and 4, right? And I believe as parents in our generation, we're not faced with the same urgency that our parents were faced with, which is we got to make a future in a country we don't know anything about, we don't speak the language. And the best way to do that is to force education down our kids' throats so that they can be at least independent from us. Maybe they don't make it be billionaires, but they can be independent, stand on their 2 feet. That's what I heard. But we have the privilege and we have the luxury to not sacrifice our health and guide our kids to a more holistic way of living so that they don't have to undo some of the things that we have to undo because we started with that mindset. So if Seema wanted to ensure that her daughter could touch her head with the back of her feet, what are some things that she could also start to help her kid develop as good life habits that stick into adulthood and late adulthood and middle adulthood?
Yeah. I want to say, we have to applaud our parents for doing what they did. I mean, it's the greatest
Yeah.
generation of all time. And, in one generation, our Indian American generation has accumulated so much wealth in this country that it's unbelievable. And it's all due to our parents' sacrifice. So I don't want to discredit them at all for that. They focused on one thing, and we have the luxury of focusing on another thing, which we should take advantage of. Um,
Right.
but yes, definitely physical health. When I was a kid, you're right. It was math and science. What do your grades look like? Not can you touch your toes? And I have a
Yeah.
daughter. She's 9, and a son that's 5. And my daughter is
Mhm.
very flexible. She likes to dance and be artistic. My son plays sports. And just the other day, during my son's soccer practice, there was a stretching at the beginning, and I saw him stretching, and he couldn't touch his toes. And I said, be better than your dad. I struggle with flexibility. Despite how much I try, I can't touch my toes. And I was like, be better than me. I mean, you really need to work on this now because your
Mhm.
tendons just get tighter. And I just did a podcast yesterday about Achilles tendon ruptures going with the NBA, about
Yeah.
tendons and muscles getting tight. It's only going to get tighter. So flexibility is great. SEMA for your daughter. Flexibility is great. Stability also very important. So just
Mm-hmm.
calisthenic exercises, planks, bridges, things where you're isometrically neutral. That hyperextension movement in little kids is fine, but you have to be cautious because repetitive
Yeah.
hyperextension, like
Right.
volleyball players, like swimmers, like, dancers, you get these micro fractures in your spine because you're compressing a lot. So balancing that with strengthening is super important. But the way
Mm.
we exercise must change. Every decade that we go through, the priorities are different. When you're at tens, first of all, tens, 20s, and 30s, you're kind of invincible, right? You wake up and
Yeah.
you can do jumping jacks right away. I wake up and I sound like my parents. With the first couple steps, you're like hobbling. You're like, what? When did this happen? When did I get plantar fasciitis? And I'm like walking like my mom used to walk because priorities are different now. In your 40s, your brain really tells your body, listen, I can't do as much as I could do last decade. So aerobics is important, but strengthening and stretching, like you got to really prioritize those things. And that's going to create longevity in the future.
Yeah.
Interesting.
So I actually have a follow-up to that because I think it applies. It's eye-opening when you see it in kids, right? But it's one of those things where you see adults and they're like not that flexible, and the story that we're all are led to believe is, well, yeah, you get less flexible as you get older, as you said. But there's this assumption that kids in general are more flexible, right? They're more open spiritually and as well as physically, emotionally, all of those things. But like my son is like yours. My nephew, when I look at him, he just has the flexibility of a brick,
Yes.
And he's always been that way. So talk to us about the things we can do to protect our spine while we look to stretch so that we're doing it safely. So we're not contorting it in weird ways. I think one of the things that I've really taken for myself and my yoga practice is deepened, not because I'm necessarily practicing more or doing more twists or more inversions or anything, but I'm noticing when my spine has gone out of alignment. And in order to fix that, that means I actually have to stretch less, right? Like, so in a specific pose, you may have to back out and your ego will tell you, oh, actually, you used to be able to quote unquote do this better because you used to touch the floor, right? But you were doing it while compromising the integrity of your spine.
That's right.
Right. So, but that is an acute awareness that develops over time. So what can people do to sort of start to cultivate that?
Yeah, I think you got to focus on balance. Our body is built somewhat symmetrically, side to side, left and right, but also front to back. Your anterior, which is your front, and your posterior, which is your back. And what we've seen is like touching your toes doesn't necessarily need to be a goal. Like who decided that that's a normal thing to do? Certainly in my age group, I'm mid 40s. When I see a friend of mine, a male who could touch their toes, I'm like, whoa, that's pretty impressive. But is that really the goal? Not necessarily, but that is one of my goals. But it's not just about that; it's about balance. So let me take two big examples of where we see the most pathology. The first is your upper body. Dinesh, you were talking about posture. We're sitting, we're texting, we're typing, and it's not that your back is weak; it's that your front is too strong. It's too tight. Your pec muscles; these are pulling your shoulders forward. The muscles in between your shoulder blades are spreading apart. Your trap muscles are working excessively to hold up your shoulders. Those muscle spasms, the nerves coming out of the traps contract, you get headaches. So now you go to a doctor and say, I have a headache. Okay, we're going to treat the headache. Let's get an MRI. Let's get a CAT scan. Let's give you drugs for your headache. Did anyone look at your posture? Did anyone feel your muscles and say, dude, it's a posture problem. It's not a headache problem. So that's just about balance, balancing tightness in the front, weakness in the back. Same thing for your hips. Like you said, we sit all day. So what happens to our hip flexors? Our hip flexors get short and tight. Our glutes, our butt muscles get overstretched and relaxed. And now there's no balance anymore. So we get back pain. We get sacroiliac joint pain. People say my back went out. So how do you fix that? You stretch your hip flexors, you strengthen your glutes, bring that balance back in. So I think that's where you have to do an individualized program. The problem with group yoga, if you think about the history of yoga, and we're Indian, so we might understand this. Yoga was supposed to be one-on-one with a yogi, and typically it was a boy, but like a young boy, to make sure his alignment is proper and correct. Now it's these group yoga classes where I've been to one of them. I'm a victim of this, where you see the instructor on top, you're like, I want to do that. I want to do the three-legged pose or downward dog like they do, no matter how much I'm accommodating and compensating in the wrong way. I'm going to bend my knees. I want to arch my back because I want my back to be flat or something like that. So, and that's where injuries happen. That's where discs get herniated. That's where hamstrings get torn. Calf, Achilles tendon. I mean, that's a big talk these days.
Mhm.
You got to do one-on-one. It's got to be supervised. It's got to be personalized. That's the way to prevent injury, and that's where you're going to make gains. Because if you have an injury, now you've set the clock back 3 weeks or 6 weeks. You got to start all over. So really, one step at a time. Be intentional about it.
Yeah. What about the new wave of GLP-1s and diet and weight loss and all of that? What is your perspective when it comes to spine health, and how does all of that interplay? Is it just that we could lose a bunch of weight and our spine is going to respond naturally, or as the weight comes off, we have to take some active steps to recondition our spine, accommodate, and not lose that balance because you're not losing weight symmetrically necessarily, right?
Absolutely right. That's a great point. And I bring that back to the math equation. I told you about head pain and posture and the forces on your neck. Same thing with abdominal weight. For every extra pound of abdominal weight or girth, it's about 7 to 10 pounds on your spine. So if you have like 5 or 10 or 20 pounds to lose, we're talking about 150 to 200 pounds less on your back. So that's meaningful
Wow.
numbers. Um, so GLP-1s. So GLP-1s are game changers. No doubt about it. It's probably going to be one of the most revolutionary drugs in our lifetime, similar to way like antibiotics and penicillin were a generation ago. But it's a tool. It is not the cure. It's not fix all, but it will get you started. And the reason why GLP-1s are dangerous is because people just rely too heavily on them. They're like, oh, I'm losing weight. I look at the number on the scale, the number is going down, I'm happy. But what about body composition? What weight are we losing? No doubt some of
Mhm.
it's abdominal fat and visceral fat around the organs, but a lot of it in the new data coming out is muscle. You're losing muscle
Yeah.
mass. So you're getting sarcopenic, which is loss of muscle mass, which is going to directly affect your longevity and functional independence. So while GLP-1s are great at kind of jump starting this process, you must utilize that window to change your lifestyle. And the way to change your lifestyle is nutrition and resistance training because you have to optimize protein and muscle protein synthesis. So one of the things that you were talking about earlier is BMR, basal metabolic rate, burning calories, right? Everyone's talking about how do I lose calories? How do I get into a deficit? Cardio was the big thing for 40 years. You get on the treadmill, you see the number go up. Oh, I lost 1,000 calories. Well, two things.
Mhm.
Number one, you didn't because the numbers are wrong on the machine. Number two, okay, what were those calories? Were they fat? Were they muscle? Were they glycogen? Nobody knows unless you actually get body comp tested with a DEXA scan. So we've shifted that from aerobic cardio to resistance training, excuse me, and protein intake because you need to build lean muscle mass in order to increase your basal metabolic rate, which is the calories you're burning all day. You increase your protein because it takes more calories to digest protein. So you're going to burn more calories that way. You increase your resistance activities because while you are just walking and living your day-to-day life, you're burning more calories than actually strenuous exercise. Because when you do strenuous exercise, you're actually burning glycogen. You're not burning fat. When you do high intensity resistance training, you burn a little bit of fat and glycogen, but then your body burns a lot of fat to restore that energy. It's called exercise, excess post oxygen consumption. But this is why we're shifting. We're shifting the way we teach about nutrition and about exercise. The paradigm from cardio to anaerobic and resistance is really happening right now.
I have a quick follow-up. So I personally struggle to believe what's true and what's not anymore. Back in the day, you would get information and you would know it's a trusted source, right? And sometimes I'll go on Instagram or social media, what appears to be two experts, they tell me diametrically opposite things, right? So right now, chiseled abs for 40-year-old men is the thing that's in, right? There's some NFL player who's like, if you make $150,000 at least a year, give me 3 months and I will get you jacked, right? Is that the goal? Is that what we should be aiming for and like allow ourselves to fall into that vanity? Or is there a myth about core training and ab training and losing weight and getting in shape? Are we just looking like we're in shape, but not really in shape?
Yeah, that's a great question. I know the TikTok celebrity or the person that you're speaking of also.
Yeah.
I do a talk on this. I do a talk called The Science of Six Pack Abs. And I open the talk with a question and I say, who has a six pack? And I kind of look around to see who like self-volunteers and raises their hand. And then I show a picture of, Oprah Winfrey back in the day when she gave everyone a car. And she's like, you get a
Yeah.
car, you get a car, you get a car. So after I see people raise their hand, I show that scene and I say, actually, everyone here has a six pack. Although you have a
Yeah.
six pack, you have a six pack, you have a six pack. The difference is some of our six packs are hidden by a layer of adipose and some are more exposed. But most of us have the architecture, the rectus abdominis muscle for a six pack. It's there. That has nothing to do with your core strength. Core is the deep abdominal muscles called your transverse abdominis that really relates to functional health. It's these muscles that allow us to go from sitting to standing. It's these muscles that allow us to pick up our kids or throw a baseball or play golf or tennis. And these are hidden. So at the end of the day, I want people to have a strong core, way more important than having a six pack. Because having a six pack isn't about strength. Having a six pack is you have to get your body fat down to a certain percentage to expose it, which is not natural. Like in order for women to get a six pack, you got to bring your body fat down to like 8%. That's not
Mm-hmm.
healthy. We know that's not a healthy weight. That affects hormones, that affects menstruation, that affects estrogen levels. For men, same thing. Got to get it down to about 10%, sometimes less, even 8%, to show those bottom two abs that people so desire. That's not the
Mm-hmm.
goal. The goal is functional independence. The goal is health, not vanity. Um, and the way to get core strength is exercise. Planks, great exercise, bridges, side planks, both dynamic and static. Crunches, on the other hand, not so good. Sit-ups and crunches, no good at
Yeah.
all. Bad for your neck, bad for your discs. Great for my business, but not good for your spine.
Interesting. Yeah, because I think we just all tend to go to what we learned back when we were in first grade, second grade PE, right? How many crunches can you do?
Sure.
And we think and honestly, that's what feels sore is those external muscles. After you do a bunch of crunches, you're like, yeah, I'm on my way.
Yeah.
But very cheeky and so hit on the head with actually everybody has a six pack and the way to get there isn't necessarily going back to goals and what should matter versus what could matter and all that. So, but you mentioned too, you're at the hospital right now, even while we're recording, but you have a spine center.
Yeah.
Talk to us about like, what do you do there? Who typically, what type of patient comes to see you? Tell us all the things.
So we created a virtual spine center almost 12 years ago. Basically, it was surgeons, rehab specialists, pain doctors, neurologists, psychologists, all kind of seeing patients virtually, but in silos. So if you saw the spine surgeon and you didn't need spine surgery, they say, okay, go see Ricky Singh, call his office. You'll see me in a couple of weeks. It was a good model, but wasn't a perfect model. So we created a physical space, a multidisciplinary spine center where we all see patients together in the same location. So we have this brand
Mm-hmm.
new office. It's in Hudson Yards on the west side. It's called Och Spine, OCH. Dan Och is one of our donors who built this program, who helped us build this program. And basically, it's multi-specialty. So physical therapists, radiologists, psychologists, neurologists, neurosurgeons, orthopedic spine surgeons, pain management, physiatrists. We all see
Mhm.
patients together in the same clinic space. All the doctors sit in one workroom. All the healthcare providers sit in one workroom. So we are constantly talking to one another about challenging cases. And what's beauty about this model is that our surgeons believe in it too. Like you said, surgeons are cut happy. Luckily, we don't have that problem. Our surgeons really want good outcomes. Our surgeons recognize that 85 to 95% of cases that come through the door are non-operative. So you don't
Mhm.
need me as a surgeon, you need Ricky. Go see Ricky. Let him work you up, let him get the diagnosis. And then if you need surgery, come back and we'll take care of it. But in the meantime, weight loss, physical therapy, maybe some interventions like injections, send you on your way. And that model has really improved our outreach, improved our delivery of this to the community. We're right now mostly in Manhattan, but we have outposts in Westchester and Queens and Brooklyn, and we're continuing to expand. But it's just a pleasure to be part of this program because everyone's around the patient. It's patient-centered experience. And if the
Mm-hmm.
patient needs to see multiple providers on the same day, they get it all done. Everyone's busy.
Yeah.
No one wants to go to a doctor and say, hey, you don't need me, see a different doctor in 2 weeks. Or you don't need
Yeah.
me, get an
Mm-hmm.
X-ray and MRI. We can do it all in the same day. And
Yeah.
that's improving patient outcomes, improving their satisfaction, obviously, but really, you know, pre preventing unnecessary surgery, of course, and unnecessary interventions. And the next goal for us is this prevention model. So we did an outreach program with Tai Chi and Qigong. We brought a master in to the center, and we had a session there 2 months ago with almost 60 attendees. We did a whole Qigong program. You can see a video of me and the spine surgeon doing it together. The next is going to be nutrition. We're going to do one on sleep. We're going to do one on flexibility and yoga, but it's really nice to be able to give back to the community.
Yeah. That is really, really, so my mom had spine surgery not too long ago. And I know, Dinesh, you've played in this land. I wouldn't say played in a, not to make light of it, but you've kind of been in this world. And my parents live in a small town. And so when we had questions about the spine surgery, my husband just picked up the phone. And I mean, it's like this Indian uncle that my dad and mom, go to dinner with every now and then. And so we just picked up the phone and called. Right. And we got answers and clarity. But we were saying to ourselves, that sort of touch point doesn't necessarily happen if we were to bring mom here, where we're in a big city and now you have to go through the system. And so it's really frustrating to have that. But I love how you guys are addressing that and making it accessible for the patient. And also it helps you provide better care, right? Like, it's frustrating when you have a question or you're not sure about something and you're like, great, now I've got to go call so-and-so across town, hope that they're in between patients and we don't play phone tag for the rest of the day. I mean, it just elevates care altogether. So that's just I'm really, really excited to hear about this.
Yeah. Is there any thought of expanding the access or locations of these types of spine centers or facilities that are sort of holistic focused, so that, people like myself or Seema in different parts of the country could get access without having to walk through the streets of New York City?
Yeah, no, absolutely. I think, and we're doing that. Dr. Roger Hartle, who's the chief of spine surgery here, and he and I are the directors of this program. We've gone to other institutions to kind of talk about the program that we built and how they can implement the same strategies at their home institutions. Really, it's about trust. The biggest feedback that we got from some of the places we went to Chicago, we came to DC, we went to San Diego. It was all about trust. Like, do the surgeons trust us, the non-operative docs, to treat the patients up and work them up to the point where they need surgery? Or are we just going to keep the patients forever and never refer for surgery? And I was like, that's a silly way to think about it. I mean, patients aren't commodities. This is a real life experience. There's a real human being at the other end of this. And think about what's best for the patient. And once everyone's thinking about what's best for the patient, then all those other questions are kind of gone. Because, we use the mom rule. I don't know why we don't use the dad rule, but it's the mom rule. If your mom was in front of you, would you offer her this treatment? Would you do this injection? Would you do this surgery? Would you offer this medication? And that's how we do it. We utilize that when we talk about spine conference. The other thing we do at our spine center is spine conference. Every week, we have a spine conference on Wednesday afternoons where we talk about all the challenging cases. So the radiologist there bringing up the pictures, physical therapy there is talking about their functional situation. We're there as rehab doctors, neurosurgeons, and spine surgeons, and we come up with a plan. Or like, we've done XYZ, it's not working. Ricky, what do you think? Dr. Surgeon, what do you think? But that really optimizes their care. So yeah, we're so fragmented in healthcare right now. Every institution does things differently, but this is a model that's really going to work. Disease-specific centers, and that's what we need. And I think we're going to lead the way in spine here at Cornell.
Yeah, I love it. Exciting. And, you mentioned doing what's best in the interest of patients, and that's a great segue into our world famous wrap up, because I know you've got probably patients waiting to see you on Friday afternoon. We live in an instant gratification world, right? We know this. Everyone wants a shortcut. So we'll give it to them right now. Tell us one thing that whether it's related to spine or work as medicine or anything, that if we all did when we turned off this podcast after listening to it, our lives would be better in very short order.
Standing up. Take the pressure off your spine, decompress that disc. The disc is a sponge. If we're sitting, you're squeezing all the juice and the nutrients out of there. Stand up, decompress the spine, bring oxygen, bring blood flow.
I actually have a really quick follow-up, just because I know the answer to tech neck is to use less tech, right? That's the obvious answer. But what's the non-obvious answer? Is there a position that we can avoid, or a position we should aim for when we're looking at our computers or looking at our phones specifically?
Yeah,
That can help.
we've done a lot of work with ergonomics, home workstations and workstations, looking at the keyboard height and the monitor height. We know that it's the phones that are challenging. And one thing I try to tell people, especially when I see them on the bus or the train, when I commute, is just hold it away from you a little bit. So instead of down by your
Okay.
belly button, hold it kind of in
Yeah.
front of you. That automatically brings your attention upward instead of downward. So small move. I'm not saying don't doom scroll on Instagram. Go ahead and do it, but just do it with proper technique.
Awesome. One of my favorite things about our wrap up is something called Ask It Forward, where listeners, if you're joining for the first time, what this means is that the previous guest has left a question for Dr. Singh, and not knowing who they are, who we were going to interview, what we were going to talk about, even when we were going to record, they just left a question for you. We have a question from Rashi Kakkar, who asked, and you actually, I was laughing because you touched on this earlier, but I can't remember if we hit record or not when you said it. But what's a micro habit or a mindset shift that you did that can help you unlock your fulfillment without compromising your ambition?
Great question. I think it's just staying consistent. I try to stay away from goals altogether. I think having goals is great. But that book, Atomic Habits, I think it's a real change in perspective. It's small micro motions. Everything is one step at a time, whether it's exercise or modifying your diet a little bit. I'm not saying cut out all bad food. I eat candy, I eat ice cream, but moderation. So micro changes in life that will
Yeah.
not compromise your ambition. It'll let you get to where you want to go.
So
love
good.
it.
So good. So what would be something that you would ask of the next guest?
I'm a physical medicine guy, so I'm going to talk about something physical. I guess the question for the next guest, whoever it is, and whatever specialty or experience is, what would you like to see your body do in 10 years that you can't do right now?
I love it.
That's a good one.
That's a good one. I was actually thinking about a very similar question. Just sort of, what did you want to accomplish, and what do you still think you can accomplish from just a different perspective? But I think we get, it's an epidemic. We get comfortable and we stop challenging ourselves. We stop dreaming for ourselves and think that this is it. This is what it's going to be like until it's too late. And then we look back and say, oh man, I wish I would have done that. And so one of the things I say, sorry to interrupt, Seema, but I'm 47 this year. There's not too much difference between 25 and 47 by way of most physical things I can do. Like I can swim, I can run, I can climb a mountain, go skydiving. But I feel like once you hit 60 or 65, there's a noticeable depreciation in the level of physical activity, right? I'm not saying I'm the same speed, but I probably can't play basketball, full court basketball at then. And so realistically, we're in the last decade to see what we can do physically, right?
I mean, there's some truth there. I think it's all about habits now that are going to predict what your 60-year-old version of Dinesh looks like. If you do nothing from now and then, yeah, you're gonna know what you're gonna get. But if you keep up with your healthy habits, I think you can modify that. So yeah, staying consistent. I think that's what I set to do, is just to be consistent. There's no goal anymore. I mean, obviously I want to improve my marathon speed and stay active and fit and be able to pick up my kids. I tell my wife, I want to pick up my kids until they stop asking me to pick them up.
I love
Because
it.
I told her, I was like, one day they're just not going to ask you to pick them up anymore. One day
Yeah.
it's going to last time they hold your hand. So I was like, I never say no. I just don't say no
Yeah.
right now. And luckily I can pick them up. Even my 9-year-old daughter, I pick her up. I put her over my shoulders. I lift her with one arm in the pool. I'll do it until I can't do it.
I love it. I love it. Good stuff.
So special.
Well, we don't have a really formal way. We're not going to send you a happy and human mug yet. We're going to say thank you for your time. We're also going to give you a chance to tell people where they can find you. But one of the ways we'd like to thank our guests is to give you the floor to share with us an organization, a charity that we can make a contribution to in your name on behalf of you, to say thank you, to raise awareness of causes that are near and dear to your heart, and to also maybe in some small way have people who've never even heard the podcast benefit from this conversation. conversation, because I know I've learned a lot of things. The audience is going to learn. You're going to get introduced to our audience, but there's a way that we can make a bigger impact. So do you have an organization or a charity that you can share? And Seema and I would be more than happy to make a contribution.
No, yeah, I appreciate that. One of the things that we're researching a lot in my institution is stem cells and orthobiologics and regenerative medicine, ways to kind of optimize healing of tendons, of joints, of discs. So we do a lot of research here at our institution, at our Stem Cell Institute. It is a nonprofit through New York Presbyterian Hospital. So I think that would be the best way for me to make a meaningful impact, is to research this so I can offer it to more people in a scientific manner. So I will give you the name of that charity, that foundation that you're supporting. I greatly appreciate that.
Yeah, absolutely. Yeah, send it over to us and we'll make that, and we'll put in the show notes and our Instagram when we make the contribution.
Great. Thank you so much.
And lastly, tell our listeners, is there anything that you want to particularly share with them? And if not, if they're just looking to connect with you, maybe grab your newsletter or just find you and follow your content, what can they do?
Yeah. So, I try to stay somewhat active on social media under Ricky Singh, MD. It's kind of a place where I just share new innovations that we do at the hospital. I share tips on health and wellness. I am in the process of getting my book published. It's called The Backstory. And
I love it.
basically, it's a kind of a pun on words because I'm a spine guy, so I called it The Backstory, but it's patient stories. It's patients that I've seen over my career here, the thousands of different encounters, and the patient's own experience working with me on how I intervened in their lives, whether we talked about mattresses or pillows, or whether we talked about sleep or screen time, or even drinking wine. Is drinking wine healthy? So just a bunch of different areas. I think it's a really light, fun way. It's not a how-to spine health book. It's really just patient stories, and I'm hopefully publishing that at the end of the summer. It'd be great to get support on that. But yeah, find me on social media, connect with Ox Spine at New York Presbyterian, and keep working on your back.
That's amazing. Thank you so much for being on the show. We're so glad you came on.
Seema, Dinesh, it was a pleasure. I had a good time.